Here I'm going to discuss how lesions of the optic pathway can lead to different visual field defects. And what I will do for this video is that first I will describe how the vision is perceived by the retina and how it's related to the occipital lobe. And then from there on, it would be easy to understand how lesions of any one of these structures, which are shown by the number 1, 2, 3, 4, 5, 6, would cause different visual field defects. Now, before I'm able to explain how visual perception works, first I would like to remind you of a simple concept of how the convex lenses work. So if you recall from physics, the convex lenses causes an image to be inverted. So if here is the focal point of the lens and here is an image, what we will have here is an inverted image. So anything that passes through the lens of the eye will be inverted. And so here in this image, anything that you see on the right side of the field will project on the left side of the right and left retina, while anything that is in the left side of the field will project on the right retina of the right and left eye. And from this point on, the right retina of both eyes via the optic nerve and then the optic tract will connect to the lateral geniculate nucleus, which is the main center that connects the optic nerve to the occipital lobe. And then from there on, optic radiations comes off of a lateral geniculate nucleus. So there are two different optic radiations that comes off of a lateral geniculate nucleus. One is the Meyer's loop, which are the optic radiations that are in the temporal lobe of the brain. And these radiations are from inferior retina. While optic radiations that are innervating the superior part of the retina are going through the parietal lobe. So parietal optic radiations are innervating the superior retina. And then from here on, the optic radiations will connect to the occipital lobe, which causes perception of the image. Now, with that information in mind, let's go ahead and discuss how any one of the lesions that is shown by the numbers 1 to 6 will cause different visual field defects. So the first defect that here we have that is not designated with any number is bilateral central scotoma. So you can see that the central vision has been lost in this patient. And can you tell me what lesion is associated with bilateral loss of the central vision? And the answer is macular degeneration. So just to provide a little more details on macular degeneration, here is a fundus photo of a normal eye. So here we have the right eye. This is the optic nerve. And then here we have the veins and the arteries. The veins are thicker vessels, while the arteries are thinner vessels. And then at the center, we have the macula, which is responsible for high visual acuity. So if you ask a patient to focus on the black dot that is shown here in this Amsler grid, they will use their macula to focus here at the center. And this is how a normal eye would see. They would tell you that the lines are all straight. However, if a patient has macular degeneration, where there is pathologic deposits of glycolipids, proteins, and cellular debris, which are called drusen, this would be the initial findings that are seen in patients with macular degeneration. So here are examples of drusens that are seen in this patient. And then in later stages, it can cause loss of the cells that are at the center of the macula. Now, if you ask these patients to focus on the black dot, first of all, they may not be able to see it because the center vision is lost. So they would say, like, which black dot are you talking about? And then if you ask them about the lines that are around, they would tell you that they are curved, they are not straight. And this phenomenon is called metamorphopsia. Metamorphopsia. So patients with macular degeneration present with scotoma as well as metamorphopsia. And the test that you use for detection of macular degeneration is called Amsler grid, which is shown right here. This is an example of Amsler grid. Okay, Now that we are done with macular degeneration, we can go back to our table. So this patient has bilateral central scotoma, which is caused by macular degeneration. Next, we have a lesion that is shown by number 1. So what structure is being damaged here? Can you tell me what structure is shown by number 1? This is the right eye optic nerve. So the optic nerve is damaged in this eye, as a consequence of which it will cause right anopia. So the vision in the right eye would be completely gone. Next, we have lesion number 2. And can you tell me what structure is being damaged here by lesion number 2? And the answer is optic chiasm, which is the center where the left side of the right eye and the right side of the left eye are crossing. And so therefore, if the nasal structure of both eyes are destroyed, it's the peripheral vision of both eyes that would be compromised. So therefore, lesion of the optic chiasm will cause bitemporal hemianopia. And this is how it would affect the loss of vision in the eye. The peripheral vision of both eyes will be distorted in patients that have compression of the optic chiasm. And can you tell me 2 conditions that are associated with compression of optic chiasm? So one is pituitary adenoma that causes compression of the optic chiasm and causes bitemporal hemianopia. And what is the second condition? It's craniopharyngioma. In any case, back to the table. So next we have lesion number 3. And what structure is being damaged here by lesion number 3? Can you tell me what we have here? And the answer is optic tract. And so the next question that comes after that is that how does lesion of the right optic tract affect the visual field? And to answer this question, all you have to do is to know that it's from the right retina of both eyes that will lead to the optic tract. So if the right retina of both eyes can no longer see, what part of the vision would be affected? It would be the left side of both eyes. So these patients will have left homonymous hemianopia. The next lesion is in the temporal lobe. And what is the name of the optic radiations that are in the temporal lobe? The answer is Meyer's loop. And these Meyer loops, which part of retina are they innervating? Is it the superior or inferior retina? And the answer is inferior retina. So if the inferior retina is affected, what part of the visual field would be defective in patients that have lesions of the Meyer's loop? So it's the inferior retina, therefore the superior part of the visual field would be affected. And then patients that have lesions of the parietal optic radiations, which are innervating the superior part of the retina, will have defective visual field in the inferior part. So on the top part, number 4, we have left upper quadrantic anopia, while with number 5, which is lesions of the parietal optic radiations, we have left lower quadranic anopia. So here we have left lower quadranic anopia. And then the final lesion is that we have is an artery that supplies blood to the occipital part of the brain. And can you tell me what artery is providing blood supply to the occipital lobe? And the answer is posterior cerebral artery. So if you have lesion of the right posterior cerebral artery, what happens is that the left side of both visions will be affected. But then one very important concept that you should be aware of is that the part of the occipital lobe that is responsible for the vision in the macula is being supplied by the middle cerebral artery. So even if you have lesion of the right posterior cerebral artery, and so therefore the occipital lobe is affected, the part of the brain that is responsible for vision from the macula will remain intact. And so these patients will have macular sparing. So the vision from the left side of both eyes would be affected, but the macula, which is the center of the vision, would be unaffected. So here, reminder that macula affects the center vision, and since the posterior cerebral artery has nothing to do with the macular area, the macular center would not be affected in patients that have impaired blood supply from the right posterior cerebral artery. Now, just to quickly summarize all these findings, let's go through the table one more time. So if a patient has bilateral central scotoma, that would be an example of macular degeneration. If a patient has a lesion of the right optic nerve, it would cause right anopia. And then if a patient has lesion of the optic chiasm, which is caused by, for instance, pituitary adenoma and craniopharyngioma, it will cause impaired visual input from the nasal retina of both right and left eye. And so if the nasal retina of both eyes are impaired, it would be the vision in the periphery of both eyes that would be affected. So these patients present with bitemporal hemianopia. And so in fact, I did have a patient with pituitary adenoma, and how it gave me clues that this patient may have some lesion of the optic chiasm was that she was telling me that she has difficulty seeing the cars that are coming from the left or the right side. She was telling me that she can see anything that is in front of her, but anything in her peripheral vision, right or left, she cannot see. So patients with lesion of the optic chiasm will develop bitemporal hemianopia. Lesion of optic tract, on the other hand, will cause defect of the right temporal retina and left temporal retina, as a consequence of which the left side vision of both eyes would be affected. So they would present with left homonymous hemianopia. If there is lesion of the Myers loop is innervating the inferior retina, so there would be the superior part of contralateral visual field that is affected. And then if there is lesion of the right parietal lobe optic radiation, which innervates the superior retina, then there would be defective visual field in the inferior part of the vision. And then finally, if there is decreased blood supply from right posterior cerebral artery, there would be left hemianopia, but since blood supply for the macular area of the occipital lobe is from middle cerebral artery, that area would be spared and would not be affected. And so the name that is given to this type of lesion is left hemianopia with macular sparing, means that the macular area is not affected. And that concludes our discussion of the lesions of the optic pathway and the visual field defects that results from any one of these lesions.